Yes, sir.
Okay. 1 second. I don't know where I've gone. Share screen.
Yes, please, sir.
Uh, okay.
Yes, sir.
I'm going to talk on how to develop a successful trifocal IOL practice. I started my practice right when the early days when Zeiss was there. They started off, and I was probably one of the earliest to start putting trifocal IOL practice. And the question is, irrespective of how great the lens is, if you can't sell that lens to a person, then it really is not going to be of any use. Patients expect a great life. Cataract is evolved, is no longer a medical procedure, it's now a vision correcting qualities. We know trifocals are exceptional. Six speakers before me have all spoken about it. But how do you effectively market a trifocal lens? Let me show you how. How do we counsel a patient? Now, the standard counseling technique, what I call as a non productive ways, you tell the patient about regular monofocal IOLs, you mention the cost and the type of monofocals available, you tell him about trifocals and the cost. And if he chokes about the cost and the price, you mention extended wear. Chances are that 75% of the patients will go for monofocal, if not all of them. Let us go into the basics of marketing for the answer, because once you understand the concept behind it, you can manage to get 70% of your patients to multifocal, which is where you should be. That's where the money is. The basic concept is, and the basic axiom of advertisement is that instead of selling a product itself, you have to make the customer want it or need it. In other words, you have to create an emotional response. That is what they say, sell the sizzle, not the steak. The features of the product itself are not as critical as the emotional connection you create with the customer. There's no point telling him, oh, it's a great lens, it's got rings, you will see great. A patient says, I'm perfectly okay with the monofocal, and you have lost that patient. So, what are the three keys to successful marketing? And this essentially you have to share with your optometrists or the ones who handle it first. The three essential steps to success: make the patient want the product. The patient will buy on emotion and justify their purchases using facts, and sell the benefits, not the features. Let me take you through all three of them one by one. Once you learn this art, the number of patients you get for trifocals will increase very significantly. An emotional concept. You want to buy a car. You have a certain type of vehicle in mind. You reach out to the potential customer and you let him know how a certain car would make him feel. It will make him feel happy. He'll be cooler. He'll be willing to go. And people will look at you in this car and they will say, "I have a great car." And will you be willing to go out? And a lot of them will go outside their range. Let us take a classical sales pitch on what we call as a LIRIL advertisement. They never sold the soap at all. They never talked about the soap. They came alive with freshness. That was the basic LIRIL ad, a girl. And that is what essentially sold the soap so tremendously. At no point did they say that the soap cleaned well or the soap smelled well. The soap was not a pride. They literally based it on emotion. Now, people have to understand, decide on a purchase, they buy on their emotion and they justify their purchases using facts. Think of it. One thing from the customer's point of view, what is in it for him? There's no point talking about a product. The product is not the point. They know, they've come to you, they know you're a great doctor, that you have a great product. The question is, okay, will they want to and will they be willing to pay more for it? So you have to explain to them that one of the most powerful techniques, therefore, of selling is to know the difference between two concepts: benefit and features. Let me explain to you how this works out. I know it may sound a little ludicrous, but when you sit in front of the patient and you sell, these things matter. Features are essentially the facts and figures of a product. Okay, great product, trifocal, etc., etc., etc. Benefit is what the patient will get out of your product. What is he going to get more by your selling this to him? To give an example, when you sell a computer, You may say it's got 25 gigs of RAM and 3 TB hard drive, and unless you're a computer person, that's very boring. But if you should turn around and say that this computer which I'm selling you will work much faster, it boots up, the battery lasts, and will make the customer's life easier, then he will go in for your product. So the whole answer is that you have to tell the patient the benefits he's going to achieve. And the other third little important question is need and want. Something that they want and can be put aside to later is a want. He may, for example, you may want to have a very costly car, but at present COVID has come. You can put it aside. That is not important. Need is something, for example, you need to have something which will make your life significantly better. Then I must have it. And that is what is a need. So you have to make a person feel the need for trifocals. The customer wants fully corrective vision, he can do with reading glasses. And if you monetize the difference, patient will automatically go for the monofocal lens. So you turn on and tell the patient this costs so much. All right, the trifocal costs so much more, you're dead. That means you have no longer are going to sell it. But you have to try and make sure that you have to explain to him that with the trifocal, he will be able to perform so much better. And without it, he is not going to feel happy. He is not going to be able to function. He won't be able to read, for example, a bus ticket or a train ticket. He will not be able to read things on the wall. He has to put his head up at a 45-degree angle to read anything which is put up on a notice board. The secret is to make the customer feel that he actually needs it and provides the reason for the need. Then they go in for that. Stress the benefit, not the procedure. Functional advantages 24-hour good vision, 180-degree vision, no poking is a functional advantage. A patient will nod his head twice and forget it. Emotional advantage. You can interact with another person without the frame in front. You can sell better. You tell the patient. If he is a salesman, it makes a world of difference. If he is a major person sitting in an office, he wants to be able to deal with a person across the table. Feel great at parties, you feel one with the crowd. So the whole thing is you sell the sizzle, not the lens. Remember, the first contact is the most important. The first contact is a refractionist. This is something Dr. Mahipal taught me when he first started off with multifocal lenses, and also when he started off with the laser. I have to stress that all my thanks apply to him. She has the refractionist has to stress that the patient is ideal for multifocals, and it will be explained later. Don't talk too much. Their job is to say that multifocals are good for you. You got a cataract, multifocals will suit you. Next point is a doctor. The doctor will tell the patient, you're good for trifocals. Again, he doesn't talk too much. That means I don't yap around the area. I mean, I have a whole line of patients that really can't do that. But that we have a trained counselor who will explain all the queries. And if you still have any questions, you can come back to me. That is all my point of contact. The role of the counselor is the most important link in selling a refractive surgery. In many ways, even more important than you are. The best investment you can make is not a new instrument, it's a good empathic counselor. Counselors have to sell, and thus they tap into the basic needs. The greatest selling agent is a warm smile. You make sure your counselor smiles there. It's, people when they train people to talk on telephones and sell objects, they are taught to smile on the telephone, not because anybody can see that smile, but because it makes a great deal of difference. And the biggest problem is never counsel with a table between you and your patient. You must seem to be on the same side. So the counselor and the patient sit not in front of a table, but not across a table. It's very important because it makes a world of difference as to how the selling goes on. And you will try it. You tried yourself. Put a table in between them, the selling goes down. And again, now the question comes about when they ask why a trifocal. And you have to tell the patient, do you want to be a visual cripple? You're not going to be able to see 50% of your vision is gone. Why do you want that? And though a standard gives reasonable distance, they're a poor compromise. And where a trifocal is not an option, but it's compulsory. You have to explain to them, for example, people who work in stock markets, and there are a lot of them in Bombay, work on architectural plans, or those who are now working, especially at home. It makes a lot of difference. I explain to them that, for example, in an aeroplane where half your objects are on top, if your pilot walks in wearing bifocal lenses, get off the plane because you can't see 60% of the equipment which is lying on top. In a similar manner. But a final point which you must never forget, you have to stress on the surgeon, not the machine. Every day I see people advertise pictures of instruments. Why are you selling instruments? Sell yourself. Why is that important? Because there are so many instruments on the machines in the market. There will be so many places selling trifocals down the line. He is selling trifocals, he is selling trifocals. But you are unique. Your machine is not. Today you have it, tomorrow your next door neighbor will have it. You stress on the machine, there's no differentiator. Why should he come to you? Why is my practice still functional after almost, what am I saying, 48 years of practicing? Is because I have always stressed on the myself. They click with the patient. Stress on workmanship. Explain to them when they say कि ये लेंस में मैंने मार्केट में जाता हूँ मुझे वहां पे इतने में लेंस मिलता है. Explain to them that a canvas is only oil and paints. Why does one painting sell more than the other? Because it's the painter, not the machine. In a similar manner, it's the driver of the car which races, not the car. In a horses, it's the jockey which wins. Has to be explained to the patient that you have, when you look at the cost of a lens, it's not the lens, it's a question of who puts it and how well he puts it. Then I usually turn and tell them about hernias. Hernias is only a jali. A jali costs you nothing. But whether your hernia is going to come back depends on how good your surgeon is. So you have to stress on this relationship, not a one-off on a meeting. Be careful also when you raise expectations, because with the amount of information available, patients expect the sun, the moon, and the stars above. Some will not be happy with anything less than 6 by 6 and 5. It's important to discover what they are and moderate the expectations. I tell all the patients they will be left with a small number. If they have to read fine print, they will have to use a little reading glass, which I give them. I give them a +2 if they carry again off with them. And we tell them that this is what it is going to be. 85% of the time you will not use glasses, not 100%. Then you don't get people coming back telling you, "Yeah, I couldn't read this fine print, I couldn't do this, I couldn't do that." Again, as a last slide, differentiate yourself in a competitive market. Always be available to your patients. Your phone must always be accessible. In a business, it is safe to say that you never want to be one of many, you want to be the best of you. Position yourself offering a service exclusive, and you will be then sought after by a specific niche of customers. As a last slide, I'd just like to stress this once again. Don't wait for opportunity, create it. Thank you very much for this opportunity. Thank you, Maipal, and the Zeiss for giving me this option or giving me this little talk here. I hope there was anybody left at the end of the entire show who was still there to hear me. Thank you so much.
I'm